I guess you could also watch on YouTube too if you want to. It's live. Okay, so right, C1, Alice, it has no body. It has no body. And C2, it has this weird thing. What's this thing called? The what? The what? I'm hearing things I don't know what they are. This is the spinous process. It does have a spinous process, and it is bifid. You can kind of see how it's bifid here. But this thing, what's this thing called? It's pointing up. It's pointing superiorly. These are superior articular facets. What's this thing? Only C2 has it. Only the axis has it. The dens. This is the dens. Why does it have the dens? Because watch, I can put this. Wait, it should be this way. I can put this on top. First, see how nicely these facets fit with each other? Oh. And then by having a dens, now this can rotate. As long as you turn your head. That's why the dens is here. And these facets, what bone articulates here on the C1? The occipital condyles, the occipital bone. Let's move your head like this. So C1 and C2, you should be able to tell apart. Question? When you crack your neck, what are you doing? It's a process called cavitation. I don't know the physics of it too well, but basically there's synovial fluid. We talk about synovial joints, and this is for popping any joint. This is also only discovered in the past like 5 years. It creates such high pressure that the gases make this sound. It's not necessarily bad. So if you pop a joint, it's just the pop of the gas. And why it's time for the gases to come back together before you can pop it again. We'll get to that with joints. All right, so that's C1 and C2. Cool? Let's talk very generally about vertebrae. This is a body, right? Is this anterior or posterior? The body side. This is anterior. The spinous process, that's posterior. And anterior, posterior. These are transverse processes. What do you call this in the center? The vertebral. The arch is the bone. This is the arch. This is the vertebral canal or vertebral foramen. Vertebral canal or vertebral foramen. The arch is made up of several parts. Does anyone know between the body and the transverse process what this thing is called? The lamina is actually right here. This is the lamina. Between the spinous process and the transverse, this is the lamina. The whole thing is the arch. This is the lamina of the arch. This is the pedicle. Pedicle means foot. If this is the mountain, this is the foot of the mountain. Pedicle, lamina. Do you see these flat parts here? So this is flat right here, and it's flat right here. Those are articular facets. Superior articular facet, inferior articular facet. When you have two vertebrae stacked on one another, those facets, the inferior of one and the superior of another, that's what articulates. The bodies, yeah, they articulate, and what's in between the bodies? Fibrocartilage, specifically, those intervertebral discs. That's not meant to move much. It's meant to support weight, but it's not meant to move much. It's these joints that move a lot. It's these joints. I can't really do it with this, but it's these joints that move a lot. That allows you to move your spine. We'll get to what these joints are called because it's a confusing name. What else? Oh, also, when you stack these vertebrae, you'll notice that there's a hole in here. That hole is called the intervertebral foramen. And you have one in between each vertebra. The intervertebral foramen. This is the vertebral canal, vertebral foramen that allows the spinal cord to go through. But in between two vertebrae, so you don't see it when you only have one, you have to have two there. Sorry, these aren't the ones that are immediately next to each other, so it's hard to fit. It's hard to fit them. There we go. This hole here, that's the intervertebral foramen. This is for nerves and blood vessels to exit out. So like if you have a slip disc, if you have sciatica or something, that disc pushes on this hole and you feel pain because it's pinching the nerve. Okay. We have 3 different vertebrae here. Which one is cervical? Left, middle, or right? Middle. We know it's cervical because of a few things. Small body, transverse foramina. Those are for blood vessels to go to the brain. Small, fairly horizontal spinous process. Points fairly horizontally. And this one happens to be bifid. Remember, bifid's only C2 through C6. C2 also has a bifid process, but C2 also has a dens. So C3 through C6 has no dens and a bifid process. Also, it looks like an elephant. These are the ears of the elephant. Here's the trunk. Looks like an elephant that's like doing whatever sound. What sound do they make? What's the word for it? What's the onomatopoeia? Honk, horn? Whatever. I don't know. Okay, so looks like someone drew dots on here. That doesn't help. Please don't point on your bones with pencil or pen because we want to keep. These are really expensive. I don't know if you have any idea how much these models cost. They're no joke. This one, I'm forgetting now. I want to get the right number of thousands. No.
What are they made out of?
Some kind of plastic thing, but we do have real ones too, and those are also a lot. Bone model box. What is this? This is a bone clone. That's the company name for this one. I'll find it in a second. Okay. So yeah, this is, see how much more this points down? Like this is pointing posteriorly, pretty horizontally. This one points down a lot and it's very sharp. So the nose of our giraffe, this is a thoracic vertebra. You can see the ears. Those are the superior articular facets. The inferior ones are the cheeks on the other side. You can see how it's flat here and it's flat here. Those are the facets. So that they articulate. Okay? Maybe it's better this way. Yeah, that's better. So yeah, that's thoracic vertebrae. One other thing that thoracic vertebrae have that the others don't, if you look at the side, you can't. There's really nothing on the body for cervical. There's nothing special here on the lumbar vertebra on the side. On the side here, there's tiny, tiny notches at the base of the body. The reason for that, what articulates with the thoracic vertebrae as well? Ribs. See the rib? This is a rib. I just took a random one, so I don't know if it's gonna fit perfectly, but it fits in like that. So thoracic vertebrae are also for ribs. So there's an articulation point between this part of the body, it's called the demifacet, and then this transverse process. Let's fit in. The ears and cheeks, superior articular facets, inferior articular facet. The holes, when you connect together, those are intervertebral foramina. You can only see it when you have them together. Yeah. Intervertebral foramen, F-O-R-A-M-E-N, is singular. Foramina, M-I-N-A, is plural. This is lumbar. Very large, chunky body because it's supporting the most weight. Large nose here. It's kind of like a flathead screwdriver. Looks like a moose. See the antlers? So you can see, like, this is the flat part of the superior articular facet. The flat part of the inferior is a bit more lateral over there. Lumbar. So again, you should be able to differentiate between cervical, thoracic, lumbar, and then specifically with cervical, C1, C2, C3 through 5, 6, and then C7. Questions on vertebrae? What about? Keep going down. Here's the sacrum. The sacrum, you'll notice, it used to be, like, early development, used to be separate vertebrae that fused together. Separate vertebrae that fused together. So those would have been the intervertebral foramina. These holes, those, if they were a separate vertebrae, they would be intervertebral. But since it's fused together, we just call them sacral foramina. So there are several sacral foramina for nerves and blood vessels to pass through. You can see this. So this is disarticulated. The sacrum articulates. The sacrum articulates with these coxal bones on the medial side of the coxal bone. And then the coccyx is just 2 to 3 fused vertebrae, very small, pretty vestigial. Kind of annoying because they get in the way if you fall. Yeah. What's next? Let me go up. What bone is this? Sternum, and what are these cartilages called? What are they called? They're called costal. Costal means rib, C-O-S-T-A-L. These are costal cartilages. Costal cartilages attached to the rib. What is, sorry, not rib, to the sternum. What is this part of the sternum called? This whole piece. This is the manubrium. Manubrium. This is the jugular notch. These are the clavicular notches. The clavicle fits in right here. I know it doesn't look like it does very well, but it does. See, this is the clavicular notch. This, between the sternum, between the manubrium and the body, this is the sternal angle. Should actually show it as slightly bent, but it's not here, unfortunately. And then this last piece down here, where no ribs articulate, no costal cartilages articulate, what's this part called? Xiphoid process, X-I-P-H-O-I-D. So here is a clavicle. This is one of the more fun bones to figure out which side is which. Because it's, you know, yeah, okay. So let's start with the different sides. The clavicle has a sternal side, and what do you call the shoulder side? A acromial. You have a sternal side and an acromial side. So which side is which? The flatter side, that's the sternal side. The flat side is the sternal side. This rounded part is acromial. This is the acromion, and I'll go over this in a minute, but this clavicle articulates here. I know it doesn't look like it does, but it does. That's the acromial side of the clavicle. Okay, so which side is medial then? The sternal or acromial? Yeah, so this is medial, lateral. Let's figure out superior and inferior. It's flatter on this side and this side, so one of these sides is superior, one of these sides is inferior. The smoother side is superior. Superior, inferior. Now we have to figure out left from right. On your own collarbone, this is how I figure it out. You can start here at the sternal medial end. Your collarbone goes forward, anterior, goes posterior, and then anterior, like an F. Anterior, posterior, anterior. At the acromial end, it comes back anterior. Starting at the medial side, I said anterior, posterior, anterior. This is the anterior side. From the sternal side, anterior, posterior, anterior. So one more time. Medial, lateral, superior, inferior, anterior, posterior. Which bone is this, left or right?
Right.
This is the right. This is the right clavicle. It'll take practice. That's the right clavicle. Just so you see how it fits in with the scapula. It fits in like that. You've got skeletons around you if you want to just take a look at the scapula. Looks like it makes more sense in context. That can be a Coracoid process there. Ouch. Okay. Questions on the clavicle? Scapula. A little bit easier to side, but still, you got to pay attention to some things. Because on either side, you've got a big, broad, flat part here. It's a fossa. But you also have a big, broad, flat part here, too. The difference is on this side, you've got this long spine with another fossa. So there's one big, broad one, spine, and a fossa. This is posterior. If you see the long, sharp spine, we're on the posterior side. This is anterior. Anterior side. What's this called? The what? The glenoid fossa or glenoid cavity. Yeah, glenoid fossa cavity. Is this lateral or medial? Lateral. What fits there? It's in here. See how shallow it is? Remember how I was saying it's dislocate compared to the acetabulum, which we'll see in a minute, which is very deep. Yeah, humerus fits in there. Okay, so that's lateral, anterior, posterior, can feel this on the sharp point of your back, on your shoulder blade. This is inferior. So this is superior. So medial, lateral, superior, inferior, anterior, posterior. This is left or right. This is your right scapula. Anterior and lateral. This is your right scapula. Some other important features. So this is called the spine. There's going to be an important muscle that's sitting in here. There's going to be an important muscle that's sitting in here. There's going to be an important muscle sitting in here. We'll get to all that later. Follow the spine. The spine starts posterior and it then points anterior. What's this thing called? This is the acromion process. The thing that's pointing anterior, this one, not this one. This is different. This is the acromion process. This is what your clavicle articulates with. This one is another important process. It's an important attachment for a lot of muscles like your biceps brachii, the one you do curls for. This is called, got to spell it out because it's coracoid. It's the coracoid process. That term in Latin or whatever means crow-like, I think. So you can either picture this as a beak, like here's a bird's head and here's a beak, or you can picture this as a perch that a bird sits on. Either way, that's coracoid. Coracoid. Important attachment for muscles, for tendons to attach to. Coracoid is more anterior. Acromion process is a little bit posterior, superior. Cool? Yeah. Inferior. To figure out inferior, always look for the pointy edge. You can put it on your back. You can have the skeletons turn around. Cool. Okay. Now scapula. What's next? Humerus. No, that is, I should get. Other one. Yeah, okay. Cool. So here's the humerus. We got two of them, humeri. Let's do the easy part first. Which side is proximal? Which side is distal? Is this distal or proximal? This is distal. So this is the elbow. Where you find the rounded head, that's proximal. Again, that fits into the glenoid fossa, glenoid cavity. All right, let's look at one for now. So I can, just having the bone rest, because you can see that it's flat right here. I can either have the head facing this way or I can have it facing this way. Which side is medial? Is this side medial or is this side medial? This side, where the head is facing a bit more medially because it has to fit into the socket, the glenoid cavity, right over here. So proximal, medial, lateral. Now, which side is anterior versus posterior? Again, I could have it this way or I could have it this way. Look for the bumps. This is the lesser tubercle, and here's the greater tubercle. The lesser tubercle points anteriorly. So once again, anterior, medial, lateral, proximal, distal. Which bone is this, left or right? It's the right. This is medial, so it fits in right here, and this is anterior. This is your right. This is your right humerus. Okay, features. So on the proximal, you've got the head, lesser tubercle, greater tubercle, shaft. On the distal end, what's this medial rounded protrusion? See how round that is? Looks like a pulley. Trochlea. 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 The trochlea is more medial, so that's another guide you can use. You can see how this is the ulna. We'll get to it in a minute. It fits in here with the trochlea very well. So you can bend your elbow. Okay, so that's the trochlea. This other rounded projection, it's not as sharp. Look how sharp the trochlea is. Looks like a pizza roller. This is more rounded. It's head shaped. It's called the capitulum. 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 Cap means head. Capitulum. These protrusions on either side are called epicondyles. Epicondylys. Medial epicondyle, lateral epicondyle. So the medial epicondyle points out a lot. It's a large medial epicondyle. On the posterior side, see this big notch? What's a term for a depression? Fossa. What's this region called? The back of the elbow? The olecranon. This is the olecranon fossa. Here's the ulna. What's this protrusion of the ulna called? It protrudes out and it's in the olecranal region. This is the fossa. This is the process. This is the olecranon process. This is the olecranon fossa. They fit in together on the posterior side. Olecranon process of the ulna, olecranon fossa of the humerus. Usually articulation names match up, so look out for that. Any questions on the humerus? Yes? Say it one more time. Oh yeah, trochlea is medial, capitulum is lateral. On the trochlea, capitulum. Oh, this is lateral epicondyle. This bump, small bump, lateral epicondyle, medial epicondyle. Give me a second while I figure out the sides for these bones. This is perfect. Okay, cool. We have the radius and ulna here. The radius and ulna, they both have head regions. Proximally, the head of the radius is proximal. And if you look at it head on, it looks like a nail head, like a flat nail head. It's very round. Whoops, it's very round. That's the head of the radius. The head of the ulna is small and it's got this pointy thing, which we'll explain in a second. And they're opposite of each other, so they're like anti-parallel. So head of the radius is proximal, head of the ulna is distal. So proximal, distal. We know the proximal side of the ulna has this nice wrench shape. Makes kind of like a U. U for ulna. Olecranon process, that's the sharp part of your elbow. See this little notch? That's for the head to fit in. It's a radial notch. Radial notch on the ulna. Between the ulna and radius, is the ulna medial or lateral? Medial. The ulna is under. In anatomical position, it's medial. So this is medial, this is lateral. This is proximal, over here is distal. This is posterior, so this is anterior. So are these the left or right? Radius and ulna, left or right? One more time, this is medial, lateral, proximal, distal, anterior, posterior. This is the left. This is the left radius, left ulna. Going on the distal side, you'll see that they form this little area here. This is where the carpal bones will fit in. This pointy part of the radius, what do you call this pointy part of the radius? Styloid process, the radial styloid process. This is the ulnar styloid process, like you can write with it, like a little pen. Okay? Yeah, hand, just to remind you, if it's curved, if it's concave down, that's the palmar side. This is the palmar side. So this is the right hand. This large bone here, that is the scaphoid. So we're starting our mnemonic here. Scaphoid, lunate, triquetrum, pisiform. It kind of comes a bit anteriorly. You can feel your pisiform at the base right here. This is the pisiform. Where was I? Right. Pisiform is this one that points out. Going back over here, trapezium borders the thumb. Trapezium, trapezoid, capitate, hamate. 1, 2, 3, 4, 5, 6, 7, 8. 8 carpal bones. Metacarpals form your palm. Phalanges, you only have 2 for the pollex, 3 proximal, middle, and distal for the rest. 2, 4, 5. Where are we now? Pelvis, right. So we talked about some features of pelvis. So these are the big wings of the ilium. This is the iliac fossa. The brim here, this is the pelvic brim, just below the fossa. This is the pelvic brim. So this is the pelvic inlet. The pelvic outlet would be down here. This is the pelvic outlet. Think of it like a basketball hoop. You got a larger rim, the pelvic brim, and then when the ball goes through the hoop, it comes out down here. Things you want to look for if you're looking for male or female. You want to look at the false pelvis. False is iliac crest. Iliac crest. You want to look for the pelvic outlet, inlet and pelvic outlet. You want to look at the shape of the sacrum and coccyx. This one curves in a lot. The coccyx is pretty horizontal. There's very little room here. There's very little room here in this pelvic outlet because of this coccyx. And then the pubic angle is very acute. It's under 90 degrees. So is this male or female? If it's adult, it's probably male. Female, you can see the difference. Wider angle, less curve in the sacrum and coccyx. Looking at an individual disarticulated pelvis, how do you figure out which side is which? Let's start with the acetabulum. That's the easiest, I think. Acetabulum, would you say that's medial or lateral? It's lateral. The femur, the head of the femur is medial, so it fits into the lateral part of the acetabulum of the pelvis, the coxal bone. So this is lateral. And kind of inferior and lateral. Inferior and lateral. Now look at the pubis. You've got a rougher edge back here, which is actually part of the ischium, and you have a much pointier part here. This is anterior, this is the pubis. So lateral for the acetabulum, anterior medial for the pubis. See this really rough edge here? People thought it looked like an ear, so this is called the auricular surface. What articulates here? Sacrum, remember? It's hiding here. That's the auricular surface. So, once again, this is anterior, because we got our pointy pubis right here, anterior and medial. This is medial, lateral, posterior. Is this left or right? This is left. And I just remember this. If you want to figure out if it's left or right and you want to pick it up, just hold it up to your ear. It fits this way, so it's on the left side. It doesn't work well. Doesn't work as well. Put the auricular surface to your ear. This is the left. It's a left coxal bone. Hold on. Auricular surface to the ear. Yeah, left coxal bone. This is called the obturator foramen. It's for nerves and blood vessels. We'll go over some more features later. We're running out of time. But you should be able to side this bone. Take some effort, but you can do it. Femur. Femur. You might want to follow on with the notes at this point, since we haven't gone over this together. What slide is the femur? 13? Slide 13? Thank you. Okay. Hopefully this is obvious. This is proximal. The head, is that medial or lateral? The head points medially. If you look on the posterior side, it's clearer that here, I mean, you can see these protrusions. See this one in here and this one here. You can see it from the anterior side, but it's way more visible from the posterior side. You can see this like it's this continuous line. So this is posterior. This thing is a feature that you only name on the femur. This is the greater trochanter, Trochaanter. Greater trochanter, lesser trochanter. It's most visible from the posterior side. Head, neck. It's got this little hole here. It's more of like a pit. It's called the fovea capitis. It's for a ligament to attach from here into the acetabulum. So this is how the hip attaches. And one more time, you can see how well this fits into the acetabulum. It's very secure. It's possible to dislocate your hip. It would take a really strong force. So much more secure than your glenohumeral joint. Yes. Yeah, people that are double jointed, it's either a shallower cavity, a shallower pit, or looser ligaments, or some mix of the two. No, double jointed. No. It just means you can bend two ways. So a more appropriate name would be like double bendiness. I don't know. Okay, to figure out another way to figure out anterior from posterior. Well, this is the distal side, the knee joint. To figure out anterior from posterior, these are called condyles. Like this big rounded thing and this big rounded thing. These are called condyles. It's kind of like if you're walking on your knuckles and your fingers curl back. These curl back. These condyles curl back. So this is posterior, this is anterior. Disorienting myself. So condyles point back posteriorly. You can see that has this little notch here. That notch is for the tibia. You can see how the tibia fits in nicely there. I'll get to the tibia in a second. Where are we? Right. So anterior, posterior, distal, proximal, medial, lateral is just left or right. It's the right femur. The right femur. For me, the hardest bone to figure out the side of is the fibula. So we're going to figure it out together. Let's go over the tibia first, though. Okay, so the tibia, it's your shin bone. You can feel it. It's very sharp, right? So figuring out the anterior side of the tibia is going to be hopefully pretty easy. Just this very, very sharp line. It's called the anterior border. That's the anterior side. It's not as sharp on the posterior side. It's a bit smoother. This little bump here, which you can also feel at the bottom part of your knee, that's a tibial tuberosity. Tibial tuberosity. And then you've got these articulating surfaces for the condyles of the knee. We'll talk about the ligaments that attach to it later. So proximal, distal. The distal end has this bump here. You can feel it on the medial side of your ankle, the rounded bump, because the tibia is like the ulna, it's medial. This is the medial malleolus. It's like a little mallet. Medial malleolus. Note it's not on this side. It's only on this side. Medial malleolus. The fibula, you'll notice how the tibia has a very sharp malleolus. I mean, it is round on this side, but it looks sharp. For the fibula, the fibula also has one side that's more rounded and another side that's more pointy. The pointy side is proximal. The rounded side is distal. So here's the rounded side. Wait, let me figure out this right side. Oh, yeah. Hold on. Okay. So the rounded side is more distal for the fibula. The fibula also has a fairly sharp border anteriorly. The fibula also has a relatively sharp border anteriorly. It's sharp. I mean, both sides are sharp. This is why it's so hard. Both sides of the fibula are sharp, but then there's a very dramatic drop off here. Can you see that? Like how sharp it is here and then how flat it is here. It's not as apparent on the other side. It's very subtle, but it's different. It's a bit sharper here. So this is anterior, distal. The sharper point of the fibula is proximal. It fits in like that. If this is the medial malleolus, what do you think this is called? Lateral malleolus. And so your talus of your tarsals would fit in right here. Left or right bones? Right. This is the right. This is the right tibia and fibula. Patella. The patella articulates with the femur. Here's the distal part of the femur. Here's the patella. It fits in right here. Nice flat surface. Okay, so we have two patellas here. The smooth side is anterior. If you look at it like this, it kind of looks like a seesaw. It also, from this angle, it looks like a guitar pick. The pointy part is inferior. The pointy part is inferior. The rounder side is superior. Now, how do you figure out which side is which? Superior, inferior, anterior, posterior. Balance it on this edge and see which side it falls to. If this is superior, inferior, this is lateral. Is this left or right? This is the right patella. This is the right patella. Look at how it's opposite from this. Right, left. Are we on, what are we on? B? What slide are we on now? 14, 15, somewhere on there? Okay. Okay, so there are 7 ankle bones. There are 7 tarsals. There are 8 carpals. There are 7 tarsals. The mnemonic is tiger, cubs need milk with a C. Tiger cubs need milk. First, it's a bit easier to figure out which is left or right because it's more obvious that you can see the curvature. This is the plantar side. Plantar means bottom of the foot. So it's left or right? The right foot. Okay. This bone here, remember the tibia and fibula? See the space right here? The space right here that the malleoluses make? That fits in right here with this bone. This bone is the talus. T is for talus. That's one on top. Talus on top. You remember what the heel is called? The heel region? Calcaneus. The bone is the calcaneal region. This is the calcaneus. This large heel bone, calcaneus. Talus, calcaneus. Now you've got this bone in the middle right here, right by the talus. So this is a superior view. Kind of looks like a boat. So you have a boat that's sailing on the seas. 1, 2, 3, 4. You have a boat sailing on the seas. The boat is navicular. Navicular means boat-like. Like Navy, navicular. The seas, what side is this of the foot? Medial or lateral? Medial. This is the medial cuneiform. Cuneiform means wedge-shaped. Has anyone taken world history, seen those wedge? Cuneiform means wedge-shaped. So this is medial cuneiform. If there's 3 of them, what's this one? This is intermediate. This is lateral. Medial cuneiform, intermediate cuneiform, lateral cuneiform. Medial, intermediate, lateral. This very last one, it's cube-shaped, so this is cuboid. Cuboid. Tiger cubs need milk. Talus on top, navicular sailing on the seas. What do you call the big toe? Hallux. Hallux is by the heel. You've got your metatarsals, 1, 2, 3, 4, 5. You've got your phalanges of the pedal region. They're also phalanges, just like your fingers, your hand fingers. Only 2 proximal and distal phalanges for the big toe for the hallux, proximal, middle, distal for the toes, 2 through 5. I have 1 minute. You have arches in your feet, right? So we're looking at the bottom of the right foot. Thank you. We're looking at the bottom of the right foot. So here's your big toe. So this is medial. This is lateral. This is the heel. So it's posterior. There's 3 different arches of your foot, and what's the benefit of arches? Just like what we see in the spine, the curves, support and balance. This is the medial longitudinal arch. This is the lateral longitudinal, and this one that goes across where the ball of your foot is. This one is the transverse. You have 3 arches of your foot that provide balance and support. If you have a high arch, if you have flat arches, like flat feet, that's an issue because that can cause problems in the rest of your joints because it's supporting your whole body. We'll review this again next time, but those are all the bones you should have. Thanks, everyone. Just a reminder, Lab Check 5 is due Tuesday. Activity 4 is due Tuesday. I sent you your revisions. If you have any questions, please ask me. You can send me progress along the way if you want me to give you feedback. Please send me emails, whatever. I'll see you next time. Thanks. And I'll be here on Friday. I'll be here tomorrow.
Yeah.
You gotta pick one. You pick 2. I can't. You pick one. You gotta pick one. Yeah.
So, hey, my buddy's someone who's another one.
Oh, he's out a little bit. What's Croatian?
They said much worse.
Okay, that's very good. I'll touch you. Okay. Yeah. Thank you.
That's kind of
1, 2, 3, 4, 5, 6, 7, 8. I think we have 8 left. Hold on, I'll give you the rest later if you need it. Yeah,